Hi everyone. In this section of the course, in this video, we will be talking about metabolism, nutrition basics, and nutrition and obesity. Okay, I'm Consumer Orlando Tanquano, and I have a master's degree in nutrition from the University of Central Arkansas. So without further ado, let's jump right into it. So the focus points, right? So we will describe the nutritional requirements across the lifespan, including selected cultural groups, discuss the role of nutrition in promoting and maintaining wellness, identify essential nutrients, including vitamins and minerals, explain factors that can affect dietary patterns, discuss food-drug interactions, reflect on the relationship between obesity and the biopsychosocial health problems. So nutritional requirements, right? So um, nutrient requirements change throughout the lifespan in relation to growth, development, activity, and changes in metabolism and body composition, right? So the nurse's role is to include the assessment of the patient's usual patterns, okay, and health promotion as well as patient education. Pregnancy and lactation. So weight gain occurs during pregnancy. Adequate nutrition during pregnancy is essential. Pregnant women should avoid caffeine, alcohol, unpasteurized dairy, raw eggs, raw or undercooked fish, processed meats, etc. Women who are pregnant lactating should ask their healthcare provider which medicines are safe to take during pregnancy. The need for most vitamins and minerals like folic acid and iron increases during pregnancy and lactation. Pregnancy and lactation, so nursing implications. So assessment of the patient's knowledge base on nutritional requirements during pregnancy and lactation. You have to provide education regarding dietary guidelines, including vitamins and minerals. For infants, right, most rapid period of growth, breastfeeding is recommended as the major source of nutrition for the first 6 months. So cow's milk is not recommended for infants under the age of 1 year. Solid food introduced at about 6 months, okay? New foods should be introduced at one at a time over a 5 to 7 day period to observe for indications of allergy or intolerance. Nursing implications. So again, these are things as if you're a patient, you should require or ask the healthcare provider assistance with. Toddlers and preschoolers. So the growth rate slows, mobility, coordination, muscle mass, and bone density increases. They can actually usually feed themselves and verbalize food. Okay, children this age often have inadequate intake of fruits and vegetables and or excessive intake of sweetened fruit drinks. So you have to avoid those if you can. Toddlers and preschoolers. So again, encourage daily physical activities to them. You have to assess child's dietary patterns and encourage regular meal times and nutritious snacks. School age children. So children have erratic growth patterns by about age 12 or 13. Most kids have lost all their baby teeth and have a full set of permanent teeth. Digestive system matures, pre-adolescent growth spurts, socialization and independence increase. Advertising has an impact on children's food choices as well. All right. So for adolescents, the period of rapid maturation, which is called puberty or growth spurt, for girls it's characterized by menstruation, fat deposition, boys increase in muscle mass, lean tissue, bone growth. Nutritional requirements increase during puberty. All right, so this group tends to consume inadequate amounts of fruits, vegetables, and dairy products, which is why you must educate them towards the best nutritional diets. All right. Now, adults and older adults. So, in regards to adults, growth ceases. There's a decline in basal metabolic rate each decade. Nutritional needs level off. Fewer calories needed. Weight gain results if adjustments in caloric intake are not made. Okay, in older adults, there's a decrease in physical activity. Loss of lean body mass, loss of teeth can make chewing more difficult, decrease in peristalsis can result in constipation, caloric needs decrease, need for nutrients increase, and risk for malnutrition, chronic illnesses such as diabetes, high blood pressure, limited income, isolation, age-related physiological changes, etc. So nutritional requirements of selected cultural groups. So everything will depend sometimes on your religion, all right? So fasting on religious holidays, etc., such as Ramadan for Muslims, etc., etc. So here is a question. So if you're a nurse, for example, right, the nurse is educating a female patient about nutritional requirements during pregnancy. The patient should be instructed to select what? Take a prenatal vitamin with folic acid and iron. This is true. Avoid raw fish and deli meat. This is true. Restrict caffeine and alcohol. This is true. And increase fat and cholesterol intake. This is true. Now, what type of fat? This is very important. Not saturated fat, but unsaturated fat that comes from mostly vegetables. All right. The nurse knows that the recommended source of nutrition for infants for their first 6 months is breastfeeding. Okay? So if you're a mother who is pregnant, who almost gave birth or gave birth already, the best milk that you can provide to your toddler or infant is, or your baby, is your breast milk. Okay? That is the most nutritious milk your baby can get. The nurse knows measures to reduce obesity in children and adolescents include increased physical activity, increased fruits and vegetables, increased screen time, no. Limit intake of sugar, yes. The nurse will educate an older adult patient to increase intake of fat and cholesterol, the healthy fat, okay, and the HDL, not the LDL. Increase intake of sodium, I would say yes. Decrease intake of processed foods, yes. Decrease calorie intake, it depends. So this might be tricky, but I would say yes, because again, if you follow a healthy diet, your calories will not be that high. The nurse is caring for a patient who practices Orthodox Judaism. The nurse will first ask the patient about their dietary restrictions and preferences, right? And tell the patient's family to bring in food from home, yes. Order vegetarian diet, it depends. Order a kosher diet, yes. Promoting optimal intake. So this is in order to achieve adequate nutrients within energy needs, maintain calorie balance over time to achieve a sustained and healthy weight, focus on consuming nutrient-dense foods and beverages like whole foods, fruits, and vegetables. All right, so balancing calories to manage weight. So there's something called the basal metabolic rate, BMR, sorry. This represents the number of calories necessary to maintain the body at rest, okay? Also known as metabolism. The strategies to do that is to control total calorie intake, to manage body weight, increase physical activity, all right? Foods and nutrients to increase. So you have to increase your fruit and vegetable intake, whole grain intake, okay? Choose those fat-free, low-fat milk products. Choose a variety of proteins such as fiber intake. Choose foods that provide more essential nutrients such as potassium, calcium, vitamin D, etc. Foods and nutrients to decrease. You have to decrease your daily sodium intake. Read food labels. Avoid adding salt to meals. Consume less than 10% of calories from saturated fats. Consume less than 300 milligrams per day of dietary cholesterol. Decrease intake of calories from solid fats and added sugars, fast foods, snack foods, and limit alcohol consumption. Building healthy patterns, right? So selecting eating select eating pattern that meets nutrient needs, right? Account for foods, beverages, food diary, health, and apps. Okay, regular physical activity at least 150 minutes per week or 30 minutes a day or 5 days a week. Okay, or you can walk 4 hours a week. That is enough to stay in shape. Track activity and use of appropriate diets like the ketogenic diet, the carnivore diet. Another question. The nurse is counseling a patient who is interested in beginning a fitness regimen. The nurse will first ask the patient which types of exercise they enjoy, right? Tell the patient they need to lose weight, instruct the patient to exercise for at least 1 hour daily in order to achieve weight loss goals, or refer the patient to a fitness coach. What do you think is the answer here? The first thing, right, is to ask the patient which types of exercise they enjoy. All right? That way, once you know what the patient likes to do, then you can instruct him to a specific type of exercise he or she can follow. Another question. Nurse is educating an adult about healthy eating patterns. The nurse will include which topics in the teaching plan? Increase daily intake of fruits and vegetables, yes. Decrease cholesterol intake, yes. Increase alcohol consumption, no. Decrease fiber intake, no. You have to increase your fiber intake as fiber helps to facilitate digestion. All right, now let's dive into essential nutrients of the human body that the human body needs. So you have macronutrients, right? So carbohydrates, fats, and proteins. Micronutrients are vitamins and minerals, right? So carbohydrates here, you have sugars, starches, and lactose. Okay. You also have functions such as converted to glucose in bloodstream for use as energy, right? You have regulate protein and fat metabolism, and they spare protein so it can be used for other functions. Types of carbohydrates, right? So you have glucose, fructose, and galactose, right? These are monosaccharides, right? So fructose is found in fruits and honey. Glucose is the result of monosaccharides converting carbs into blood sugar, right? So that's why you need to decrease your carbs, right? Disaccharides consist of sucrose, which consists of table sugars, maple syrup, fruits and vegetables, lactose, anything related to milk. Maltose comes from the breakdown of starches, malt products, and beer, and polysaccharides such as starch, grains, beans, and legumes, fiber, indigestible substance in plants, foods, glycogen, which is a type of stored energy source found in the liver and the muscles, right? So glycogen is nothing else than glucose that is stored in the liver, okay, mostly, okay, and that can be broken down and released into the bloodstream in case you are experiencing hypoglycemia, which is a situation in which the blood sugar levels in the body are low. All right, so are all carbohydrates bad? Absolutely not, right? What happens when glucose enters the bloodstream? So here you have a small depiction, right? So first of all, glucose enters into the bloodstream. It is stored mostly in the muscle fibers, right? Because your muscle needs glucose to properly function, right? And again, remember, the pancreas secretes beta cells, right? When insulin levels are low and when your body needs insulin because your blood sugar levels are high. Just keep that in mind. Fats, lipids. So what are they? Lipids. So most concentrated source of energy in the diet, right? Hormone production, form adipose tissue that protects internal organs, provide insulin to maintain body temperature, and aid the body in absorption of fat-soluble vitamins. So you can see that lipids are pretty much healthy. That's why it is mostly part of the ketogenic diet, right? The ketogenic diet refers to a high fat and high protein diet, right? So, what are the different types of fats? Of course, there are triglycerides, which is predominant form of fat in food, okay? Major source of fat in the body, saturated fats found mainly in animal sources. The characteristics are solid, more stable, have an extended shelf life, etc. Unsaturated fats, usually found in plant sources such as olive oil, avocado nuts, and trans fats, man-made fats, commercial food, right? Processors add hydrogen to unsaturated fats. This changes the fats into a more solid and stable. Purpose is to extend shelf life for processed foods like baked goods, fried foods, and margarine. This is why you want to stay away from all those trans fats and highly processed foods, right? Because they can cause high blood pressure, diabetes, and so forth. Cholesterol, right? So it's a fat-like substance found only in animal products, okay? It's a component of cell membranes, okay? Its function is used to synthesize bile acids, precursor of steroid hormones, okay, and vitamin D, okay? And there are two types of cholesterol. So the HDL is the good cholesterol, high density lipoprotein. It carries cholesterol from tissues to the liver, which removes it from the body. Whereas the low density lipoprotein LDL is the bad cholesterol because it carries cholesterol to arteries and tissues. Why should patients with heart disease limit their cholesterol intake? Because again, if you have lots of LDL, bad cholesterol, then it means that you might be vulnerable to clogged arteries, which is why patients that suffer with heart diseases need to curb their cholesterol intake, right, in order to allow proper blood flow through their arteries and avoid a possible stroke or a myocardium infarctus. How much fat and cholesterol is in fast food, right? So you have these examples again, I don't need to go over them, but as you can see, these fast foods are high in bad cholesterol, which is why you should limit the intake of these type of fast food options. Now, what is protein, right? So protein is a vital component of every cell in the body formed by linking amino acids in various combinations for use in the body. All right, so you have animal sources, plant-based sources, etc. Proteins are important because they provide energy, tissue growth repair, regulates fluid balance, forms antibodies, transports fats and other substances through the bloodstream, and they regulate acid-base balance. Which types of patients would benefit from increased protein in their diet? So, any patient that is suffering from chronic illnesses, chronic diseases, right, such as high blood pressure, diabetes, will definitely benefit from an increase of protein in their diet. Now, let's talk about vitamins, right? So, vitamins are organic compounds called also coenzymes, which facilitate chemical reactions in the body, right? They're essential for the metabolism of carbohydrates, protein, and fat. Types are water soluble, B complex, C fat soluble, A, D, E, K. So you can remember this mnemonic, ADIC, okay, or the fat soluble vitamins. So let's start off with vitamin A, right? So the sources of vitamin A is found in the liver, carrots, eggs, yolks, fortified milk. Its functions is important for vision, immune function, and healthy skin. All right. So it contains beta carotene, right, which is a precursor of vitamin A, comes from green leafy vegetables and intensely colored fruits and vegetables. Vitamin D. Sources, dietary sources include fish oils, fortified food, fortified cereals. Vitamin D is important for calcium, phosphorus metabolism, and bone strength. So you can find them in cheese, butter, margarine, etc. Vitamin E, right? So you have sources from vegetable oils, wheat germ, whole grains. It's an antioxidant which prevents or delays some types of cell damage, radical damage, right? So free radicals, red blood cell synthesis as well. So you can find vitamin E in corn, nuts, olives, green leafy vegetables, vegetable oils, and wheat germ. Vitamin K, it is important for blood clotting. So K clotting, that's a way to remember it. Found in green leafy vegetables. Newborns are given a vitamin K injection to prevent hemorrhagic diseases. Now, here are the functions of vitamin B complexes. So you have B1 thiamine, energy metabolism and glucose, by B2 riboflavin, energy metabolism, B3 niacin, energy metabolism, B5 pantothenic acid, which is also for metabolism. Okay, B6 pyridoxine, also for metabolism, hormone regulation, brain development function, B7 biotin, metabolism. So if you want to improve your hair growth, your nail growth, biotin is also very important. B9 folate, which is important in synthesis, repair of DNA and RNA, RBC production. B12 cyanocobalamin, metabolism, RBC synthesis, hemoglobin. So this is a lot, of course, but again, just keep in mind that vitamins, especially the B vitamin complex, are essential for energy and metabolism. Vitamin C sources are from citrus fruits, berries, broccoli, and peppers. Functions antioxidant and it enhances iron absorption. Minerals, what are they? They are inorganic and compared opposed to vitamins, which are organic, right? So minerals are inorganic elements found in body fluids, tissues. Okay, they provide structure with the body, within the body, and regulate body processes, such as iodine, for example. You have calcium, which comes from dairy products, greens, broccoli, spinach, soy products, and calcium is kind of like vitamin D. It is important for bone formation and muscle function, cardiac muscle especially. Phosphorus, right? So dairy products, meat, poultry, eggs, bread, cereals, soft drinks, functions important for acid-base balance and bone tooth formation. Magnesium, green leafy vegetable grains, okay? Its function is good for bone, tooth formation, protein synthesis, carbohydrate metabolism, regularity in cardiac muscle contraction. Sodium, salt processed foods, snack items, fast foods, its major role is in acid-base balance, okay? When sodium levels are too high, it causes elevation in blood pressure and fluid retention, so which is why you want to curb your sodium intake. Which types of patients should reduce their sodium intake? Again, any patient that is suffering from chronic illnesses, chronic diseases, high blood pressure, diabetes, right? Alzheimer disease, right? Any type of chronic illness is not a good idea, okay, to take sodium. All right, so how much sodium is in fast food, right? So again, another depiction to show how detrimental fast food chains are to the human body. Potassium, right? So potassium, you have fruits like bananas, tomatoes, avocado, leafy vegetables, and it's important in the balance of acid base, fluids, cardiac muscle contraction. A little bit kind of like salt, like sodium. So potassium and sodium go in pair. Chloride is also a type of salt. Okay, it's also very important for respiratory function and cardiac function as well. Iron, one of my favorite supplements, right, is found in meats, whole grains, right, and its function is to bind with hemoglobin in the bloodstream, so for oxygen transport. Iodine is table salt, okay, it's important for thyroid function. Zinc is important for immunity, okay. Water, so water accounts for 50% of an adult's total weight. Two-thirds of body's water is contained in the cells. Beverages, solid foods, water intake should be 2 to 3 liters a day for adults. Aids in digestion, absorption, circulation, excretion, and metabolism. Intake should equal output. Fluid balance altered in severe dehydration, GI illness, hemorrhage, and severe burns. The nurse is caring for a patient prescribed a low cholesterol and low saturated fat diet. The nurse shows which of the following foods should be limited. Now, again, we're talking about a patient who was prescribed a low cholesterol and low saturated fat diet, which means that that patient might be suffering from chronic illnesses, right? Chronic, excuse me. So, therefore, this patient should avoid steak and eggs, and also dairy products. But that patient can definitely eat spinach and bananas. Another question, the nurse is caring for an elderly patient prescribed an oral vitamin A supplement. The nurse knows the purpose of this supplement is, again, we're talking about someone who is lacking in vitamin A, right? So this patient is definitely suffering from vision and immune function. That patient is suffering from, I would say, that's it, vision and immune function. Now, again, if the patient has comorbidities, we can include other options such as anemia and thyroid supplements. The nurse is educating a vegan patient about non dairy sources of calcium. Which of the following should the nurse include in the teaching plan? So, again, everything on this list is applicable. The nurse is caring for a newly diagnosed diabetic patient who asks about low carbohydrate meal options. The nurse knows the best meal for this patient is. Again, let's have a look. I would highly recommend number A because it's full of protein and vegetables. That's it. If you look at other options, then you see there's carbs, there's pancakes do have carbs. You don't want grilled cheese because, again, depending on the patient. But again, the best option here would be A. If they asked you for two options here, I would go for A and D because these options are high in protein and high in lipids. A patient asks the nurse about dietary sources of vitamin K. The nurse knows the highest amount of vitamin K is found in green leafy vegetables. The nurse is caring for a patient with high blood pressure who is on a low sodium diet. The nurse educates the patient to reduce intake of processed foods, right? Because again, processed foods are high in sodium. And when your sodium levels are high, your blood pressure also increase. Another question, the nurse is educating an adult patient with anemia about dietary sources of iron. Which foods should the nurse discuss in the teaching plan? So spinach is definitely in there, beans definitely in there, raisin brain cereal definitely in there. I would say maybe lentils, but definitely not soy milk because it does not contain any type of iron. All right, so food-drug interaction absorption. So drugs taken by mouth are absorbed through the lining of the stomach or small intestine. Some drugs have decreased effects when taken with food. Review dosage instructions every time, right? Food-drug interactions, gastric irritation. Some drugs need to be taken with food to avoid gastric irritation, indigestion, or gastric ulcers. Review dosage instructions must be taken with food. Okay? Examples such as aspirin, non-steroidal anti-inflammatory drugs such as ibuprofen. Food and interactions with drugs, foods that alter metabolisms, action of medication. So, for example, grapefruit juice interferes with the metabolism of certain medication, resulting in an increased serum level of the medication. Example, cholesterol lowering medication, atorvastatin, Lipitor. Okay. Foods with vitamin K, green leafy vegetables, decrease the anticoagulant effects of blood thinner medication, warfarin, Coumadin. Now, let's pause this video right here and ask yourself, why does green leafy vegetables decrease the anticoagulant effects? It's because simply vitamin K favors blood clotting, right? So if warfarin, Coumadin decreases blood clotting, vitamin K does exactly the opposite. Number three, herbal supplements cause potential interactions with prescribed medications. Important to ask patients what OTC med supplements they are taking. The nurse is preparing to administer atorvastatin, Lipitor, to a patient with high cholesterol. The nurse educates the patient to avoid grapefruit juice, apple juice, right? Because all those juices might be high in sugar, right? And you do not want to mix sugar with bad cholesterol levels. Another question, the nurse is caring for an adult patient prescribed warfarin Coumadin for treatment of deep vein thrombosis, DVT. Which of the following should the patient limit? Of course, apples and grapes. And all the rest are rich in iron, so the patient should be taking A, B, and C, spinach, kale, and broccoli. The nurse is preparing to administer levothyroxine Synthroid to a patient with hypothyroidism. The nurse knows the drug would be administered with, again, here, hypothyroidism means that your thyroid is not working, which can be reversed with a high intake of iodine, for example. So the nurse knows the drug should be administered with food, okay? Because you want some level of iodine in the body. Obesity, epidemiology. So more than 20% of adults in the United States are obese. Over 30% of young people between 2 to 19 are overweight. Okay, so this can be related to genetic, environmental, biochemical, and behavioral factors. Now, what is the body mass index, BMI? It is your metabolism, right? It is based on your weight and your height. So depending on the value that you get, you can actually determine if you're underweight, if you have a normal weight, if you're overweight, or if you're obese. So BMI is calculated by dividing the weight in kilogram by the height in meter cube. Central obesity. So apple versus pear shape. Again, these are just different types of obesity depending on your morphology. Obesity and biopsychosocial health problems. So about half of all American adults, 117 million individuals have one or more preventable chronic conditions, many of which are related to poor quality eating patterns and physical inactivity. Examples, cardiovascular diseases, high blood pressure, type 2 diabetes, some cancers, and poor bone health. Nurses' role is to health promotion and patient and family education. Another question to wrap everything up. The nurse knows which of the following are risk factors for obesity in adults. Family history of obesity, high fat diet. Now, again, this is tricky, but I would not include this because it depends on what type of fat. If it's in saturated fat, maybe, but if it's in unsaturated fat, not. So the answers for sure here are B and D. Sedentary lifestyle and family history of obesity. The nurse knows an adult patient with a body mass index and BMI of 34.8 is characterized as If we look back here, let's go back. 34 is right here, so it is obesity, right? And the nurse knows that a patient with central obesity is at risk for which of the following health conditions? Again, everything here, vision loss, constipation, hypertension, type 2 diabetes. This just goes to show how detrimental being obese can be for you. And here are the references that I included for anyone who wants to follow up and do a little bit more research down the rabbit hole. Thank you very much for viewing this video. If you have any questions, please do not hesitate to ask them in the resources section below. Thank you.